First, though, some breaking news this evening. The dire state of the NHS has been laid bare in a rapid review by independent peer Lord Darzi, who has described the health service as in serious trouble. Well, Matthew Thompson joins me from the Department of Health. Weeks it's taken to carry out this review and ahead of a speech by Sir Keir Starmer tomorrow. So what have you learnt, Matthew?
Well, you say dire. I mean, dire is almost putting it mildly. This is a devastating assessment of the state of the NHS, frankly, which the report says is failing on its most important promises to the British people. So on waiting lists, on A&E, on cancer and cardiac services, on access to GPs, on maternity services. I mean, the list goes on. It describes crumbling buildings, outdated machinery, outdated systems. It describes exhausted and disengaged staff. And, you know, it frankly ultimately concludes that the NHS is, in the words of the report, in a critical condition. But it does offer some prospect for fixing it. It's not entirely doom and gloom in its 140 or so pages, although mostly so. And I think its conclusions are likely to dominate politics, certainly until we break for recess on Friday, and probably long beyond that. You mentioned Keir Starmer is going to give a speech tomorrow in which he says that the NHS must now reform or die. So pretty strong words. And the report offers some explanations for why the NHS is in the state that it's in. The aftershocks of the pandemic, perhaps an obvious one, but it's also highly critical of the structural reforms undertaken by the coalition government after 2012. And it also is critical of austerity, the lack of capital investment over that same time frame. And it concludes that Britain is effectively a sicker nation than it was a decade or so ago, and that's put extra stress on the NHS whilst it's trying to deal with all of those other challenges. Now, Keir Starmer tomorrow will, unsurprisingly, put the blame squarely on the Conservatives, as he's done so many times over the last few weeks and months, but he will say that he has a choice: either raise taxes on working people to fix it, which he's not prepared to do, or reform and modernise the NHS. And Labour, he says, or will say, are working on a 10-year strategy to do just that.